Hi there, I'll be talking for the next few minutes today about surveillance and data sources within public health and epidemiology. So the things we will be covering in this short video are to talk about what surveillance is and why it's so important in epidemiology, talk about some of the major sources of surveillance data focusing on the US, and then distinguish between different kinds of data sources and talk some about the strengths and weaknesses of a few of those. So first, let's start with a quote from David Satcher, who was a US Surgeon General. And he said, in public health, we can't do anything without surveillance. That's where public health begins. And so that's what I want to emphasize today. Really, the critical need for surveillance is to establish those dimensions of descriptive epidemiology. So the person, place, and time, who is experiencing specific health events or disease, where is it happening, and what does it look like over time? And so that's really what surveillance is all about. Surveillance in public health means that we're collecting data in a routine and ongoing manner, so it allows us to look at those trends over time. So I like to think about data coming from two different levels. So we can either get information about everyone in a population, which is of course what we would ideally like to do, but it's hard for lots of reasons. And so this could be called a census generally, and I'll talk about our US Census specifically. And the great thing about these kinds of data sources are that it provides us a denominator for all of our other calculations. But most of the time, because of the logistical challenges of collecting information about everyone in a population, we take information on a sample. So we're not going to spend time talking about sampling today, but I encourage you to review that from other sources if you need a reminder on how to collect a good sample, a representative sample. So first, let me spend a minute talking about those data sources that do cover an entire population. And in the US, we have a decennial census, so a census that happens every 10 years, which is actually part of the Constitution. And the goal of it, the purpose of it, I mean, is to enumerate the number of representatives that different areas have in the House of Representatives. But we have expanded its purpose to include looking at demographic, economic, and health-related information. In the past, we did this via a long form, so a subset of respondents got this longer set of questions. It was about 1 in 38 households. Now we do it a little bit differently. The American Community Survey happens annually now among a subset of people, and then the full census happens every 10 years. So here's an example of the kind of information we can get from the census. This covers the different types of disability that people experience. And so this is broken down by age groups, so looking at those 65 and older, among whom disability tends to be more common, versus those under 65. Another example here is looking at some changes in policy. So this map represents the changes in the uninsured rate for people age 18 to 64 following the Affordable Care Act's passage. And so you can kind of look at states that passed Medicaid expansion tend to have more blue, meaning that there was a greater change in the uninsured rate. Information and data from the census are available on the website. So census.gov has basic information like the questions. You can actually look at some of the data itself going to data.census.gov. And I really recommend looking at some of the things that have already been created, like narrative profiles and data profiles and maps for specific regions. But you can also browse the data for yourself, and there are versions of it that have more detail that you can apply to use. The other source of information we should have on everyone in the population is vital statistics, which is birth and death certificates. And so in the US, we have standard forms that are available at the sites listed here, and states can collect more information if they like. One note about these is that they can be completed by different people depending on where and the circumstances of someone's death. So that's an important consideration when you think about using these data. Who actually provided the information? Might any bias result from that? How do data get aggregated from the local up to the national levels? And what kind of data quality measures are in place? And so these would apply across countries, across jurisdictions, as well as within. Those are also available online at the CDC's website, and you can search it through the Whiskers and other data programs through CDC. And then I just want to briefly mention a few information sources that are commonly used in public health that rely on samples. There are lots of different types of them, so I won't be covering all of these today. I'm just going to touch on some surveillance systems, but I do want to note that registries, medical records, specific studies, and other non-health related data sources can be really informative. So registries are where we select people who have a specific condition and follow them over time. It's very helpful for things like rare diseases or conditions that might not get picked up in a population-based surveillance system. And non-health related data sources might include things like purchasing records at pharmacies to give us a sense of how many people might be sick at a particular time, using GIS and other movement data sources to help us see where and how things might be spreading. As I said before, a surveillance system is systematic and ongoing. So it can help us detect epidemics, assess how big a health problem is, and then document the person, place, and time characteristics of its spread. Active surveillance means that we're actively going out and trying to find cases, while passive just relies on people reporting to the system. So a few last surveillance systems I want to mention. One is the National Notifiable Disease List. So this covers many infectious diseases. It's a list of conditions that must be reported to a local health agency, and they get reported up to the CDC. Here's a sampling of them, but the full list is available online. And those data allow us to track things like anthrax over time or foodborne outbreaks. And then the other major surveillance systems that are ongoing in the US are the National Health and Nutrition Examination Survey, which actually brings people in to take measurements. And then the Youth Risk Behavior Surveillance System, which samples young people in schools, and they do the surveys themselves. And the Behavioral Risk Factor Surveillance System, which is of adult, non-institutionalized members of the population via telephone. And those data are also available on various websites. I've included some about the BRFSS there. The last thing I want to note is how to, well, some things about establishing surveillance systems, and then we'll talk about strengths and limitations. So it's very expensive to establish these. A lot of pieces need to be in place and go into establishing them. And so typically we have some criteria for setting up a new surveillance system. And that would include things like how often is something happening? Are we actually likely to detect it? How severe is the outcome, and how worried is the public about it? How much does it cost? Is it preventable? And can it be transmitted from person to person? So finally, the strengths of surveillance systems are that they tend to have broad coverage. So we're trying to cover entire populations. They are by definition ongoing and systematic. But the limitations are that because we are doing so much breadth of coverage, we often have limited depth. And when we rely on passive reporting, we can get biased estimates. And generally, they're only representative of a single time point. So while we can look at samples across years, it's generally not the same people that we're following over time. So we don't have longitudinal data in that sense. So that's an overview of surveillance in public health, along with some of the strengths and limitations. Thanks for listening.